Sana. Ito for. Ay, mga sayaw, cancer. Ito, medical center. Hosting. Salam master. Healthy cook, healthy salad. Wala oil. Sa Pilipinas. Nabigay sila ito ko healthy cookie. Surdong. Live, dami live. Oh siya. Palalo ko yun. Wala. Yung doktor, ay Pilipino doktor, pupunta sa Life, Jamaica. Nakita ko siya ulit guys, dito siya. Magaling yung sigit na sayaw. Mamimbi, sayaw. Naka-pink t-shirt. Para size daw yun. Size. Bahay yun. coach. So, wait lang. Yate. Ito si ate na to. Doktor. Deliver. Magain sila ng sala. Chocolate cake.
Okay, so I believe in that what Dr. B.Hub said, that diabetes is reversible. It is because recent studies have shown that in very early stages, and you do diet modification and you reverse all the risk in worldwide. And discuss the three very important, but frequently neglected issues about diabetes. Okay? So, my question is, how are we doing about the UAE and diabetes? It's very important, no? 1.185 million in the UAE are diabetic, and most of the diabetics here in the UAE are within the 32 to 44 years age group. And one thing about I'm proud of not here in the UAE is this. Because of the government's initiative to actually improve on the knowledge about diabetes, the wonderful access we have in terms of medicine, in terms of healthcare professionals. The UAE was able to decrease its prevalence of diabetes from 19.3% in 2013 to 11.8% in 2017. Okay, so that means somebody from a country who has 1 in 5, a population of 1 out of 5 people that have diabetes, you're able to decrease it 1 out of 10. So I think the government has done a great job. The government has done a great job in trying to address diabetes here in the UAE. See, there are 3 topics not discussed by the doctors in the diabetes, no, it's a silent killer. Okay, you know that.
Hindi guys, kung sila guys, yung vaccine sila guys. Dami ko po dito. Subscriber lahat dito.
Guys, you can join
Mga bago.
please. So those who have injuries already.
This point. So this is the normal eye. Okay. This is the picture at the background of the eye, which is the retina. This is the innermost layer of the eye, in which it's a very light-sensitive tissue that converts nerve impulses. So whatever we see will be interpreted by our brain as image, okay, through the optic nerve. This is the optic nerve, and this is the macula. This is where we see fine details and we see color vision, okay? So remember this. This is the normal eye. Now, this is the one which has diabetic retinopathy, okay? So what do you see here? It's obvious, right? So you see this? These are blood clots, okay? And this white stuff, these are the ischemic areas, meaning these the oxygen doesn't reach to these areas because of the weak blood vessels. As I said, that's how glucose.
Metiste ayan po siya. Or
40 and above.
Um, already diabetic yearly. It depends on if you control your blood sugar well. Can be yearly, but if you have this existing problems, it depends on the stage. You should go like 6 months. Yeah. If you're in the early stage, every 6 months. But if you are in the like kind of middle stage, you have more. It's like 3 to 4 months. It depends on the signs and symptoms.
I am Samantha. May we call on Miss Ellie? Number 5.
metiste ayan po siya.
Our next speaker is a pediatric diabetes. Let's all welcome Dr. Hanny Johan.
My name is Dr. Henry. I work in Angelina Children's Hospital as a pediatric optometrist. So first I want to thank Events for Change collaboration with Sweet Mamas and Ms. Horizontal for this opportunity to speak and discuss about what I'm actually talking about the eyes. And because this is a diabetes there are so many ocular conditions that is related to diabetes. And we will talk about that tonight, this afternoon. So I believe Dr. Lab has covered already some of the prevalence of diabetes. It's usually like 1 out of 5. Yeah. So internationally, according to International Diabetes Federation, 1 out of 9 adults are living with diabetes. And it is responsible for 1 death every 9 seconds. So imagine that. And it affects children. As we all know, that there are many cases for children in which as young as they are, they are already diabetic patients. Mostly, they have the type 1 diabetes and with a number of type 2 according to National Institute of Health. So since diabetes, it affects a lot of multiple organs. First, let's. I know this has been discussed, but let's just like refresher, review something. So the type 1, as what Dr. B.Hub mentioned earlier, it is when the body cannot make enough insulin, when it can make insulin at all. Why? It can be family history, genetics, and there are certain viruses that triggers the immune system to attack the islet cells. What's these islet cells? These are the cells that produces the insulin hormones. So the type 2 diabetes, this is more like a lifestyle. So when it's too much glucose in the blood, because the body is not making enough insulin. That it can cause hypertension. That's why diabetes one of the most common causes diabetes.
Tapos na. Ibang doktor. Filipino rin. Sikap na.
B.Hub, they can have ketchup already. So, what does the patient see with ketchup? It's a vision because sometimes you don't know what's going on with your eye unless you have it checked, right? So, at night, if you
So we have three areas here which are micro, against the macronutrients and fiber. What are the micronutrients? The micronutrients are the vitamins and minerals. Yeah, there are four types of micronutrients. Number one is the water soluble micronutrients. The water soluble micronutrients are these are the body needs it for a day. They don't store it. Yeah. So, which means the two major micronutrients is the top micronutrients is actually vitamin C and vitamin B. Yeah. So the body cannot store that, hence you can we all do that. Do you know that we are required actually of 32? You'll be okay if you have about 32 different varieties, different species of food every single week. But if you can take a look at that. You know, one food has a lot of ingredients already. However, is it the right food that give you a well balance in your body that is disease fighting? So the food should be actually nutrient dense. Yeah. Most of the food, particularly I'm going to stress on the plant base. They have the antioxidant power and gut health. We all know that gut health is very essential. When you eat foods that cleanses, diabetes, which is the inflammation, cardiovascular diseases, and of course, the cholesterol and all that. Yeah. So fiber is a very good way of helping on lowering the risk of the complications. Yeah. So this is what we call the nature's pharmacy. It's really amazing. Yeah, sometimes we just go to the grocery, pass by, I see a lot of people, I used to be guilty of that. We just pass by the vegetable area, the fruit area, because we're not concerned we go straight to the yeah, which we love best, yeah? So just to let you know of the essential of these fruits and vegetables to our body, not only regulating our blood sugar cycle, but improving our body and helping in cell generation. Fact, this is a fact. Did you know that every single day your gut replaces 300 billion cells? 300 billion cells. Our body is made up of cells, right, Dr. Duff? Yeah? So how your cells is, if your cells are healthy, then your organs are healthy, the rest is healthy. Yeah? The body function is healthy. 300 billion cells. The question is, what are you feeding the 300 billion cells? Are you feeding in a way that improves your health? Or are you feeding it in a way that destructs, that destroys the cells? So if you get damaged cells, reduce, what do they reproduce? Partly damaged cells. You get me? Partly damaged cells. Partly damaged cells every single day. But if you're feeding your body healthy, clean food every day, you are producing healthy cells, restoring cells, healing cells, yeah, rejuvenating cells. Yeah, that is why they say, a lot of diseases are actually reversed. Okay, again, we are what we eat. Yeah. One example that I want to stress, I'm just going to stress some few here. Mushroom. Do you know that half a mushroom a day is cancer fighting? Yeah. Half a mushroom a day is cancer fighting. Again, beware, don't go behind heat, okay? Half a mushroom a day, okay? Because we can't eat it raw, right? Some mushroom can make you, especially wild ones, can make you, drunk and groggy. Broccoli. Broccoli is also cancer fighting, and broccoli has more calcium than a cup of milk, and it's high in vitamin C. So, a cup of chopped broccoli has about 89 milligrams of vitamin C. Did anyone know that? Yeah? So now you can fill your everyday with broccoli and mushroom. Yeah? So, I know a lot of you knows about onions and garlic. They're good for our cardiac health and all that. And of course, the apple a day keeps the doctor away. What else? Did you know the seeds in berries, which is called the polyphenols, help break down the shield that cancer cells put up to hide from the immune system? Yeah. So you've got all that. Eating seeds are actually associated with longevity. Who wants to live longer? We all do. Yeah. So again, if we want to live longer, we have to be aware, we have to be mindful of the food that we eat. Yeah. So seeds can also help you in inflammation. Can also reduce biomarkers that causes inflammation. Okay, this is from Johns Hopkins University. The manner in which we prepare, because remember we talked about the right order, right? I'm going to talk about the right technique. The manner in which we prepare and cook our food has the potential to significantly impact our well-being. John Hopkins says the combination of hot heat, water, and oxygen is disastrous to vitamins and minerals. Yeah. So when you actually expose your food to open air, high heat, and you're cooking the vegetables and all that, with a lot of water, it could be disastrous to its vitamins and minerals. Cook all food at low temperatures to retain the vitamins and minerals. Unless we eat food properly prepared, we suffer from inferior physical development, mental instability, low endurance, and lack of resistance to infection. So it's all about low temperature cooking. These are what nutrition scientists say, the enemies of nutrition. And this is the process of cooking. The number one that we do actually, when we cook our vegetables is we peel, right? Nutrition doctor says, that nutrition scientist says, that anything that grows under the ground, the nutrition is under the seed. We peel it off, right? We throw it in the bin. Yeah? So the nutrition is under the skin, so you throw off the nutrition. Anything that grows above ground, nutrition is in the core, in the center. Now I'm going to ask, what?
1,004 guys. Fiber now guys. Visit Life Pharmacy guys. Like, share, comment, subscribe.